Hi guys. Let's see. We lost our connection. I guess we were on for an hour, so hi. I'm gonna see if Jess can get back on here with me. And if not, maybe we'll do part two later on. I don't know. Let's see what's happening. I'm gonna text with her from my laptop. Let's see. All right, requests. Let's see if Jess is in here. There she is. Okay. She's coming.
Hi.
Huzzah!
I don't know. I guess you can only do this for an hour?
I guess so, which I didn't realize. So, hi, we're back.
Hi.
Hi. Okay, so what I was going to ask you, I was just looking through, I've got our Google Doc and then I've got questions from the audience that we have.
Mm-hmm.
We were just talking about closures. Some people were asking if we really need to keep the schools closed. And per what you were just saying about, obviously, like, listen to the government mandates, listen to the mandates because they're coming from the healthcare community, then yes, schools need to be closed. I do just want to highlight for people out there, check your local school districts, because I know that here in Los Angeles, where I live, a lot of schools are still providing hot meal lunches. The lunch staff, the school staff are coming in to cook for the kids, and they're giving those bagged lunches to children. Families can come and pick them up from school twice a day, I believe. Mm-hmm. I don't know what's happening in your county, but that information should be available, because there's a lot of kids in this country who only get hot lunches or food at all from their schools. And so we should really be thanking our healthcare workers and our school staff who are willing to do this stuff right now.
Yeah. San Francisco's doing the same thing. They're providing breakfast and lunch for kids of low-income families who depended on those meals. So
great.
Yeah.
Great. So that stuff feels important. And yeah, if schools are closed for the rest of the year, that's just where we're at, guys. Again, we're so lucky to, live in a world where there's educational videos for kids and activities and things that you can do with them that you can look up or find on YouTube or find on Netflix or whatever you have access to. That stuff feels pretty important. And it might be a great time to figure out how to offer some of that support to folks in your community who might not have access. If you have access to art supplies and things, maybe you can share those in your communities or neighborhoods. There could be a family could organize a spot for a drop off and have families come and pick stuff up. So think creatively would be one of my recommendations there. We talked about how people need to stop. We talked about this earlier, how people need to stop ordering masks, leave them for the healthcare community. We got a question last night from a nurse. Her name is Brittany Maxwell. She works in Orange County. Mm-hmm. And this feels really important to answer as per the healthcare community. And Brittany, thank you for sending it in. She asked what the best practices are for healthcare providers. We've been talking about, for all of us, social distancing, allowing for better outcomes for people who have to go to work, the folks in grocery stores and the folks at hospitals. But for nurses and doctors in hospitals, what are their best practices, in your opinion, as a scientist, Jess, when they leave the hospital and they go home to their families? She was asking what she should do to protect her family, her children. Should she change her scrubs? Should she sleep in another room? Do you have thoughts on that, or other tips or recommendations?
Yeah, I mean, I have a lot of friends and family who work in the healthcare community, and it's been interesting to see how safety and protocols for infection control are really hospital specific. It's a little interesting to me. So each hospital has their own protocol when it comes to what it takes to get in. One of my friends who's a nurse in San Diego says that they check everybody's temperature before they come in, or they've asked if they've had a fever within the last 24 to 48 hours. Okay. I have another friend who works as a nurse anesthetist. So she is in sterile environments in surgery all the time. And so because of that, she's required to put new scrubs in when she's there and leave her dirty scrubs there and put new scrubs when she leaves. That to me seems like the safest. I would imagine whatever requirements are for sterile environments in the hospital would be the cleanest,
Okay.
But again, I don't think that everybody has the kind of environment or place to do that in every hospital, or the access to multiple sets of scrubs to do that, you know.
Right.
I think that there is an inherent risk with people who are in the healthcare community. And I think it was the New York Times that did this really beautiful infographic, an interactive one, that showed people who are at highest risk, and it was doctors and dentists. You know, there's just, those are the heroes that we need to be, you know, really thankful for. But again, it goes back to my other friend's point, who's a doctor here at UCSF. You know, hospitals are trying to also, you know, pace out the effect on their own staff. And it means like some of them who will have to work from home or be in reduced hours. So, I mean, I would say if you can practice protocols that would be the ones required for the most sterile environments.
Got it. That's great. We talked about how this impacts hospitals, how it impacts hospital supplies. Let's see. One of the things, we talked about hot weather theory, we talked about schools. One of the questions that people are asking because of some of the reporting that's coming out is, if you get COVID-19 and then recover, can you get it again? Is there information available in your community about reinfection?
So again, I'm not a medical doctor, so can't give medical advice. Yeah. There have been reports that some people have gotten reinfected. There was a report about a woman in Japan who was a tour bus driver who got it and then recovered and then got it again. I think this is why we need more testing. I think this is why we need to figure out the types, if we are dealing with two types that are prevalent here in the US, the L type and the S type. From a just understanding viruses perspective, you usually build enough immunity or antibodies so that you don't, but it also can depend on viral load. I mean, if somebody is getting a huge amount of viral load, it's very different from somebody who was mildly exposed and recovered very quickly. So that person may not have had the chance to, on an immune system level, build enough immunity or antibodies so that they are not susceptible again.
Right, and that again goes back to why it's so important not to take this lightly, because we don't want to overwhelm the healthcare system, because doctors and nurses are exposed to higher viral loads than the average person. Yeah. And so when we think about their risk doing their jobs and taking care of us, and also the sort of lesser numbers of supplies that we have, you know, whether it's masks or hospital beds, it's really important to take social distancing seriously.
Absolutely. Absolutely.
Yeah. Okay. There's a couple more questions here. Two things that feel related. Are there instructions or recommendations that you've heard about for people with asthma? I wonder about that. Hi, because I'm asthmatic. And also for immunocompromised family, you know, again, like my dad has very severe asthma, and I had to fly back to the US from Toronto on Saturday because all productions have been put on hold. We're all out of work now. And I won't go see my family for at least 21 days. Yep. But do you think that that's the right call? Do you think it should be longer? I know you can't give like technical medical advice, but just in the ballparks, are there things that folks like us could do to protect our families and to protect ourselves?
Yeah, I mean, I've had a lot of people talking about, like, should we go see our parents who are over 65? Should we isolate with them? Should we have meals with them? And I am going to always, on this topic, err on the side of extreme caution. You know, we are actually in an hour east of San Francisco with my in-laws, who are a lot younger than my parents. They're still in their 50s. They're really in great health because, you know, we live in a tiny apartment in San Francisco and wanted to give the chance for our kids to spread out and have some outdoor space in the backyard. But we made the choice to not drive to LA, which is where my parents live, because both of my parents are older and have, you know, conditions that make them more susceptible to having a bad outcome. So I would say that for those of us who have parents who are elderly, or who have parents, not just necessarily elderly, just over 65, or who have comorbidities, to avoid contact, at least for now. If you have a pre-existing condition or an autoimmune issue or something like asthma or a lung infection, I would say err on the side of caution and stay in. You know, especially don't go out if you can avoid it. And I would for sure prevent people from coming in and out of contact with you, because the last thing you want to do is risk having a really bad turn of events for you.
Right. And when we think about that, when we think about, you know, taking care of people in our lives, like our parents, you know, or the elderly, you know, I have some neighbors that are much older, and I said to them, you know, hey, look, if you need somebody to get groceries for you, I'm happy to
Yes.
do that. What are best practices for that? Like if I were to buy groceries for my neighbors, should I get them, put them on their doorstep, sanitize the grocery bag handles? Like
Exactly.
how do I do that to be good to those people and take care of those people, but not risk infecting them?
Yeah, a lot of people are concerned because like fomite transmission, which is like, you know, anything that's an object that can be holding the virus or carry the virus. People are
like plastic, steel,
right,
cardboard, whatever.
Right. There's still conflicting data about how long it can live on surfaces. There's some data that says a couple hours or some data that says a few days. I've heard in general, though, that the risk for things like grocery bags and whatever is pretty low. The transmission via that is not as high. So if it means serving your elderly neighbors really well and like putting groceries on their doorstep, I think that's a great act of service. I think that's a great way to help. If you want and, you know, wear gloves and avoid as much contamination as possible, you can do that. But I don't think there is a protocol right now of like spraying the bags with Lysol or anything like that. I think, you know, some grocery deliveries are still happening. Takeout is still an option because, you know, not everybody can cook and prepare meals at home every day. So there is a much smaller risk than being like in dining in restaurant. But it's, you know, much better than the alternative.
Okay. Great. And when we talk about, you know, to your point, obviously we can't go eat at restaurants. There's a lot of people who are very paranoid about like takeout and delivery right now. Yeah. What I've been doing, and you can tell me if this is okay or not, but again, I so far feel fine, thankfully. I've been ordering delivery from some of my favorite restaurants because I really want to try to support those people. I know that their lives are turning upside down right now. And what I've been doing is when the takeout comes, I've been using my, you know, cleansers and disinfectants and just wiping down the containers before I open them just to be safe. Is that?
We did that last night too, you know.
Okay. I gotta let this dog out. Keep going.
Go ahead. Yeah. I mean, I don't think that officials are giving that kind of specific directive, but, you know, there are ways that people can practice their own hygiene on that. And if they feel like it would be better for them to wipe it down with, you know, a disinfectant wipe, by all means do it. If it's not affecting your actual food, do it, you know. There is always going to be less risk if you're preparing your food at home yourself. That's just the fact. But there is a much, much lower risk if you do take out versus a dine-in situation, which is, you know, pretty much prohibited in a lot of places now.
He just really wants to talk to you.
Hi.
And this little peppers. Okay, so that's super helpful. And then on the topic of food, you know, there's been a lot of like panic about, I mean, honestly, he's very sweet. Can you just relax? Thank you. Can you lay down? Can you be a good dog? Can you lay down? Yeah. Yeah, I will say, just side note, because I mean, this is happening. A lot of dog rescue organizations and animal shelters are really overwhelmed right now. So if you have the opportunity to, and you can foster an animal, it's a pretty cool way to cope, and they like just make you happy. So there's a little side note. But back to food, there's been a lot of obviously panic. People are stocking up at the grocery store. Something I do want to highlight, and you guys can Google this. It was a New York Times article that came out the day before yesterday. All of our food suppliers in the country are saying, like, guys, we have enough food. The issue is more that because the demand has gone up, the supply chain has to catch up. So, you know, deliveries need to increase, trucking, things like that. But I just want to encourage people to stay calm about that. The United States is not about to run out of food. We are okay. So just like take it easy. And again, you know, let's make sure that we're taking care of elderly folks. And there's a lot of grocery stores that have instituted the first hour of the morning for the elderly to come to the grocery store and get food so that they don't have to, you know, kind of jostle around with people to do that. So I just felt like that article was really sort of helpful for anxiety. And
yeah, it's been really great to see some grocery stores actually enact policies where the first couple hours of business are, you know, protected for those who are elderly or immunocompromised. That's really, really cool.
Yeah. And then there's a lot of questions happening. I'm just looking through this. We've gotten through food, we've gotten through a lot of those things, but a lot of people are coming up in the comments, and this was something I wanted us to address. Women are asking how COVID-19 affects pregnancy. Mm-hmm. And I know, again, we don't have enough data. Is there anything that we do know?
I mean, so far, again, I'm not a doctor, I'm not an OBGYN, so can't make medical recommendations here. But so far, what I've read from the data is that there haven't been signs of vertical transmission, which means mother to baby while the woman is pregnant. But being pregnant, and I've been pregnant twice in my life, is an immunocompromised state. So you're at risk already of getting things because your body is in a state of inflammation, your body is susceptible to getting infection. And so pregnant women want to be really careful to stay hydrated, to stay healthy, to stay home if they can, because that's a risk for them. I will say one of the really, really sad consequences of social distancing and the fact that hospitals are trying to really prevent what's called nosocomial infections, when people go to the hospital and actually get sick from the hospital, is that partners are not being allowed in delivery rooms right now. Which, like, we're talking about, you know, people potentially having babies and people potentially dying alone. And so that's another thing to kind of like add to the severity of this situation. Like, they're trying so hard to protect the hospitals, and we need to be prioritizing that, keeping the hospitals safe and staffed and healthy, that, you know, and we want our pregnant women to be supported in that way too. Like, think about all the women who are going to be having babies right now. Life goes on. You know, the pandemic is happening, but people are still having babies. Yeah. So if you are pregnant and you're concerned, I would say, you know, obviously talk to your OBGYN if you haven't. I've heard some women are opting in for inductions pretty early, like earlier than their due date, so that they avoid the potential spike in the bell curve. Oof. I know.
Those are big decisions.
Big decisions.
And what about, is there any data yet? I can't imagine that there is, but I just feel like I got to ask, is there any data yet talking about how this affects babies?
Yeah, again, can't speak medically on that, but, you know, there was a report of a newborn case in the UK. That was apparently the youngest case. You know, babies are extremely vulnerable. They, you know, they're just really fragile and vulnerable. Another reason why we need to keep our hospitals healthy. Right. Yeah.
Okay. So social distancing. This is so important. Yeah. Because again, to your point earlier, it's not just about us.
It's not.
Like, we might think we're going to be fine, but it's about our parents. It's about people's babies. It's about pregnant women. It's about the elderly. And to your point, there are younger and younger people who are sick. You know, a friend of mine just posted a thing yesterday, a guy, sorry, I don't know. I think he's a musician. I don't know if he's like a DJ or a singer, but he's, you know, in his 30s, and said, like, he got this thing and felt like he got hit by a bus, and he's on an oxygen machine. Yeah. And so it does affect people of all ages. Yeah. And it's just so important. And that was one of the sort of next things in the doc was, you know, can this hurt younger people? And one of your answers was about comorbidities. What does that mean when we hear that term in the news? What are you guys talking about in the science community?
Yeah, a comorbidity means a pre-existing condition or a condition that is happening at the same time as another illness that decreases your chance of surviving, or that makes the disease that you are suffering from worse because you have something like asthma or an autoimmune issue. You know, some people who have autoimmune issues are on suppressing kind of drugs to help them, you know, and, you know, I have family members who are like that as well. And because of that, you know, the slightest whiff of anything can make them really, really sick. And kids can have autoimmune issues. Kids can have asthma. Kids can have cancer. And so while kids are faring well on the whole, much better than the rest of the population, you know, there are some kids that are really vulnerable that we need to be thinking about as well.
Okay. Okay. So let's see. We went through pregnancy, hot weather theory, stocking up on food, just making sure we're getting all these things together. So again, when we think about what we can all do, a lot of us are feeling really powerless, and, you know, being trapped in your house, not being able to see your family, those things can make us all feel stir crazy. And also, I don't know, at least for me, it's such a reminder of just how small we are on this planet. Mm-hmm. And I'm really curious about how you think from our homes we can be activating around this. You know, we talked about how when you've got to go to the grocery store, maybe get something for your, you know, your neighbor. What are our options as far as kind of social activism right now?
Yeah. I mean, if everybody really thought about the external impact of social distancing, I think it would turn all of us into champions of this activity. You know, if we thought about it in light of how one person in Korea was responsible for 80% of the cases in the country. One person. I mean, that shows the smallness and the bigness of one person.
Yeah.
You know, the impact that somebody can have, and how powerful, even if it seems sedentary, but how powerful it is to stay home. It is actually an active thing to do, to stay home. Even if it means you're snacking too much, or not being as productive, or feeling down about not going outside when the weather is glorious. It's actually a very active role to be staying at home. And I think we should all be pushing that message out, because there are still people who are not just not getting it, they're posting it on social. And so I think we could all be, you know, champions of this cause, echoing that message. And really, I want to re-emphasize too, that we're doing this for the sake of our infrastructure, for our hospital infrastructure. We cannot risk our hospitals being overwhelmed, because if we do, that is when you start to see catastrophe. Right. You know, that so many people died in Italy because they couldn't even get into the building. They were in triage outside and they couldn't get the care. That would be horrifying to see in the United States. We just can't risk that. And people need to realize that we don't have enough beds, and we don't have we don't have enough beds, and we don't have enough people to help care for the kinds of numbers that could potentially happen.
Right. So two questions that are coming up over and over and over again in the comment section while we're talking about all of this stuff, are about ibuprofen and also about short walks. So there's been a conversation in the last 24 hours in the media landscape about how taking ibuprofen can actually lower your immune system. Is that true? Do you know? Again, I know that you're not a medical doctor and can't give medical advice, but is there a responsible source to go to find out if that's really a thing? What do we know?
Yeah, the source would be the WHO, because yesterday they issued a statement that they checked out the data. They could not make a definitive recommendation against it. Against it, right. But that was not they could change, because they're still doing the research. They said at an initial glance that that's what their assumptions were. Now, if people have to take it, I would talk to their doctors. But so far, as of yesterday, the WHO said that they could not validate that and make a sweeping recommendation against.
Okay.
Yeah.
So basically that just means that per the World Health Organization, we need to wait for more information.
We need to wait for more clarification. We need to wait for more guidance.
Okay, good to know. Yes, someone was just like, vitamin C is great for your immune system. True. Eat oranges. Yes. And then,
what was the second question you were saying?
And then a lot of people are asking if they can go on walks, like short walks in their neighborhood, get outside, get some fresh air. How do we talk about that?
Yeah, so, you know, when Mayor London Breed here in San Francisco was issuing her shelter-in-place mandate, the last thing that they mentioned was, okay, look, you can't go anywhere unless it's essential. But if you want to go on a hike, or if you want to go out, you know, to get some fresh air, to be out in nature, whatever, just maintain social distancing. And so, or physical distancing in this case, like social distancing, physical distancing is safest if we are 6 feet apart from each other, because that is what they are saying is safe distance, because if this disease is spread through droplets, that's about as far as a cough or a sneeze spray can go. That's about the range. So they're saying maintain 6 feet of distance. Don't go to crowded places. If you see people, just kind of keep your distance. So dogs, pet owners, pet parents need to take their dogs out for, you know,
Yeah.
to go to the bathroom. They need to get some fresh air. People need vitamin D. We need sunshine. Those things are real. So if you have some outdoor space, use it wisely. Use it wisely. Just don't go to crowded places and don't go in groups. The recommendation is to go with the people that you are isolating with.
Right.
Or
So
alone.
if you're isolating with your partner or your sibling,
yes,
you guys could go for a walk together. But
together.
you shouldn't meet friends and go for a walk.
Exactly. Yeah. You
Right.
go alone or with the people you're isolating with. Yep.
Okay. And when we talk about pet parents, you know, we did say earlier that these strains of COVID, this strain COVID was transmitting initially through animals.
Yeah.
But can you clarify? Because what I've heard, and maybe I'm wrong here, but I've heard that does not mean you can get this from your dog.
You cannot get this from your dog. And there's no data to suggest that dogs are actually at risk of getting it themselves.
Great. Awesome. Yeah. So the data around animals was more, you know, to be graphic. And I'm actually going to backtrack a little further here. There was really terrible misinformation coming out that was also incredibly racist, that this disease came from people eating bats, which is in certain areas of China a food practice. And that's not true. What the data has found is that viruses that are carried by animals transmit through their fecal matter to other animals. And that fecal matter, if it contaminates something, some other food source, can be how human beings get a disease. And that happens to us here in the US and everywhere all of the time. If you don't, you know, wash every piece of lettuce perfectly clearly, you might get food poisoning from it because there's fecal matter on it from some animal. You know, we've seen all kinds of viruses that get transmitted that way, but you know, we should not be spreading misinformation, and we should also understand that if this happened initially in transmission through fecal matter, that means that you're not going to get it from your dog or your cat licking your face.
Well, the transfer of it being like a zoonotic disease, an animal-based disease to humans, it's already happened. So it's not going to go back and forth, back and forth. It's a human-to-human transmissible disease right now.
Okay.
You know, but going back to your point, we have been exposed. I mean, Ebola is a perfect example of getting a disease from eating contaminated animals, affected animals. And so there are practices of eating all kinds of wild meat that can be at risk. They're still doing research on the exact origin of this illness, so it's not helpful to speculate, especially when it causes us to not speak well about people who are as affected as we are. Other humans who deserve respect and dignity, and to not be called horrible, horrible things that even have come out of our president's mouth just a few days ago.
Yeah, we're not doing that here.
No.
Yeah. Hold on, there was just a question that went by and I didn't type it out and then I lost it. Okay, so I'm just trying to think about anything else that feels important. I feel like we've covered a lot.
We have, yeah. You know, I think that we've made it pretty clear that social distancing, physical distancing is about others, and it's about our hospitals. You know, it's really important that we think about how, you know, this is going to be a long haul season, that this is unprecedented. Nothing about this should feel normal because this is an abnormal situation. And so I think if we try to work together on how do we address mental health impact here, how can we be creative about being social. I mean, my daughter is 3.5 and her ballet class was turned into a virtual class, which was so wonderful. I mean, I just thought that was such a great way to pivot in the middle of crisis. She is a creature of habit and usually is like a little bit weird about a new thing. And within minutes, she was like, this is the best. And so we got her dressed up in our living room and she did ballet as if it was, you know, in her studio. So I think there's so many ways that businesses are going to have to pivot here too. And I think that's really cool to think about the opportunities here. I know there's so many people focused on all the losses and all the catastrophe and all the, you know, ways things are going to die. But, you know, I'm talking like even businesses and restaurants and stuff, but think about all the ways that we can create. You know, let's think positively about this. Like you said, let's be creative about ways we can share, about ways we can commune together, eat together.
Yeah.
You know, there are so many ways that we can look at this as an opportunity.
I agree. I actually just yesterday, I've got some friends who run a dance studio in New York called Forward Space. And every day now at 11:05, so they just started 1 minute ago, 11:05 Pacific, 2:05 Eastern, they're doing a 20-minute Forward Space class on their Instagram Live. So in my living room, I did a dance class yesterday, and it was great.
So
I was like, oh, I needed this.
Yeah. And
Yeah.
kudos to all the businesses that are offering these things for free. I mean, so many companies are offering their really, really nice dance classes, their access to their websites and their apps for at-home workouts. I mean, that is just such an amazing way to love the community.
Yeah, it's really huge.
Yeah.
Yeah. All right. I think that this is a really good sort of beginning. One last question I do have. This will be the last one, and then, you know, my thought is maybe we'll do another one of these in another couple days, because
let's do it. Yeah.
Not everybody could tune in today. What can we all do? We mentioned earlier that there have been 45 people who just volunteered to go straight to a vaccine test without it being tested, you know, on animals, without any clinical trial. I mean, this is a big deal.
This is phase 1. Yeah.
Yeah. It's huge that they did that. Is there any way that we, as, you know, citizens who are concerned around the world, can support scientists in their efforts to create a vaccine? Is there something we can be doing? Should we be donating blood? What can we do to be supportive?
Yeah, that's a great question. I have not seen any calls for massive donations like that, but that's a good thing to look into. But I will say there are a number of, you know, universities that are doing really exceptional research that you can donate to. There are a number of nonprofit groups. Sorry.
Oh, hi.
He just ignored. He had his earpods on. My phone's about to die, so that's how I'm going to plug it in. But yeah, there are a number of even just groups of science communicators like myself that are just a network of people that are trying to help people understand these complex messages and science that is being a little bit misconstrued at times. You can donate to those groups. But let me think on that more, because that's actually a great concept. Yeah.
Yeah, and maybe we can put out a little, you know, call to the healthcare community and the scientists you have access to, and the next time we get online to talk about this, we can see if there's something we can be doing to support them.
I will say, if people have hoarded PPE, any personal protective equipment, if they've hoarded hand sanitizer or masks, to donate them to hospitals. If they're unopened,
donate those to
unused,
your local hospital.
Yes, to give them to people who actually need them. I've actually heard this really cool, I read this really cool thing where I think Don Q, which is a rum maker in Puerto Rico, and the LVMH group are changing they're gonna, instead of making rum and like luxurious perfumes, they're just gonna be switching to making alcohol to provide for the needs and shortages. So if you've got a stockpile, please consider returning it or donating it.
Yeah, that's huge. And to your point, an unopened stockpile, they have to be sterile.
Yeah.
But if you bought 10 boxes of, you know, masks on Amazon, please take all the unopened boxes to your local hospital and drop them off.
Yeah.
All right. Badass.
All right, girl.
I love your science brain, Jess.
Oh, I love yours. Thanks so much, Soph. It was so good to talk to you.
Thank you.
Yeah, we'll do this again.
Y'all. We'll see you in a couple days.
Bye.
Okay. Bye.